to present in about 30 minutes. Just want to be mindful of everyone's. Oh, I just saw the TDP people. You guys are so cute. Hi. So yes, I'll aim to be done in about 30 minutes, but of course, like I'll stay on if I don't know if we get really into the discussion, we can stay. Thanks everybody for being here. I really appreciate you guys. Okay. So okay, we can see this, I hope. Okay. So I will be presenting on two different things today. The first is my research project on self-disclosure and fear in pediatric music therapy, and then the second on a completely different project called the Brenner Album. Let me get this. Okay. So yes, feel free to come and go as needed, and we'll just get started. So self-disclosure and fear. I decided to study this because before I even got here, I was curious about fear and anxiety management in music therapy. This is one of the main goal areas often for music therapy in the pediatric hospital, as a lot of children struggle with fear and anxiety, and children are often able to express things musically that they don't or can't verbally or otherwise. And also as music therapists, we have the advantage of being there entirely for the child, so we don't poke them, we don't prod them, they can say no to us, and so our bond with them is really special, and this has a really profound effect on fear and anxiety. I also observed that it was effective, just kind of subjectively. I kind of had a couple of experiences where I was like, I think that self-disclosure kind of has something here. And then when I started to look into it, the existing literature was pretty limited. I found a couple of articles on self-disclosure in therapy and pediatrics, and then I found even fewer articles on self-disclosure in music therapy and pediatrics. And the last reason is because I personally was in the hospital a little bit as a kid. So that's me a couple of months before I was diagnosed with a teratoma tumor. I was in the hospital for 2 weeks, and for me, the worst part was the surgery. I think it scared me, and anxiety is probably what I could have used the most support in. So now it's really cool to be able to like provide that with kids and to be able to talk to kids about, hey, do you want to be distracted while we get your shot, or do you want to watch it happen and know what's going on? So yes, also, one of the experiences I had in my first couple of weeks here was there was this 5-year-old girl, so a year older than I was in that picture, and she was completely inconsolable. She was freaking out, crying, just not having a good time. And she was uncomfortable. She was, I think, bored and tired and ready to get out of there and to see her siblings. And something told me to talk to her about my own experience. So I kind of got eye level with her, and I told her, when I was your age, I was in the hospital too, and I remember how uncomfortable it was, and how much people smiled at me, even though what was happening was really scary. And we kind of talked about it for just a second, in 5-year-old friendly terms. And her demeanor just changed, and she was like, really? And then she started to warm up to us. She shared her favorite song with us, which was Don't Touch My Truck. And we rewrote it to be Don't Touch My Arm, because she didn't like getting her blood pressure taken. And so that was just a really cool moment where I was like, wow, maybe I have I was kind of erring on the side of like, don't talk about yourself, it's not about you. And of course, it's not about me, but there were a couple of times during my internship where it felt relevant and helpful to bring up my own experience with the kids. So, yes. This is what brought me to study this, and this is the method that I eventually landed on. I had Lainey kind of help me with a couple of different options for studying this, and then I eventually kind of landed on these. So what these are called over here is a visual analog scale. So how it works is I had these printed out. This is the child version, and this is the teenager version. So I did this for about 12 and up, and these for like 11 and under. And before and after sessions, I would have kids mark how they felt on the line. So are you feeling more like the scaredy cat? Are you feeling more like the chill duck? Where would you be on that line? And then in our sessions, I would either self-disclose or not self-disclose, depending on which experiment group they had landed in. And then at the end, I would have them mark one more time on a new sheet where they felt. So the advantage of this kind of scale is that they can't see where they marked. Whereas with numbers, like you can remember, oh, I put a 2, so I want this lady to feel good about doing her job, so I'm going to give her a 4 now. But the visual analog scale is like, hopefully that eliminates some of the bias. I will say the downside is I don't think that a lot of the kids got it. I had to throw out some of the data because some of the kids just scribbled on the sheet or circled the cat or something. So I think if I could do it again, I would maybe do like a scale of faces or numbers or something like that. But I've always thought these were really cool, so I just really wanted to do it, honestly. Oh, and the other thing about it is it's exactly 5 inches. So after kids would mark on it and I would kind of look at it later on, I could just measure it and then make that a percentage. Ideally, it would be 10 inches, so then I don't have to do a bunch of math to make it a percentage, but it's just how it worked out for this, that it was 5 inches. So at the midpoint of my internship is when this project started. And from that point on, I only collected new patients for the study. So I didn't use any patients that I had previously worked with just because I couldn't be sure whether or not I had self-disclosed with them or not. I flipped a coin to decide whether or not they would be getting self-disclosure or not. So if it was heads, no self-disclosure. And if it was tails, that meant tell. So I would tell them about myself. I would use self-disclosure with those kids. Like I said, before and after each session, they would record how they felt. And then afterwards, in my own time, I would put that on my spreadsheet. Do we have any questions about this? I feel like this might be confusing. Feel free to unmute if you, okay. I'm looking at the group. It looks like things are going well. So this is my data. This is my sort of big mess of things, and we'll kind of briefly just go over this. I know this is kind of a lot to look at. So I had the date and then what group they were in, their pre and post-test measurements, some just kind of colloquial notes, like subjective things, and then of course a code name to keep things HIPAA, and then their age and their diagnoses. So this is the data points that I got from that. So if we would just pay attention to this side, these blue dots are the heads group, so the kids that I did not self-disclose with. And of course, this is how they felt pre-test and post-test. So on a scale of like 0 safety, like feeling really, really anxious, to 100% safety, this is where they scored before and after. And then for the kids that I did self-disclose with, this is where they scored before and after. So if we convert all of that into percentages, everybody went up. Yay! So overall, people felt more safe after music therapy sessions, which is great. And really, there's not a significant difference between the self-disclosure group and the non-self-disclosure group. If you're really into statistics, this is a little bit funky because even though technically the no self-disclosure group went up by a higher percentage, because of the standard deviation, like because of how spread out things were, this is actually considered a smaller difference than this pink line here, if that makes sense, even though the self-disclosure group went up by 11%, whereas the heads group went up by 14. So that's just kind of a little interesting aside. But overall, there really wasn't a significant difference between either. So to summarize that, it appears from the quantitative data that the individual music therapy sessions positively affected feelings of safety for children in the pediatric hospital. Sessions, including self-disclosure, produced similar results to the ones without self-disclosure, and there was no significant difference between them. Now, I did take some notes, if you saw in my giant data sheet, and I thought that some of these were worth sharing. They're just qualitative, subjective data. So here, this kid asked me questions about myself that I avoided. Depressed affect took a while to open up. So this kid was a kid that was in the heads group, so I wasn't allowed to self-disclose about myself. but he was asking me questions about himself and he was struggling with opening up. And I just felt that that was relevant to share, that he wanted to know about me. And I had to like purposefully put on the like blank slate persona. And then I'll just share one more. This patient was tearful talking about surgery. I shared about my surgery and she asked me questions about it. Patient shared her dad has had surgery and hearing her dad talk about it has helped her. So this just kind of points to another situation where she was really tearful, and then as I kind of told her about my experience, she appeared to sort of become less tearful and ask me questions, and then she talked about her dad kind of having a similar conversation with her and how that had been helpful for her. So my personal interpretation of that data, the qualitative data, is that maybe children prefer sessions with self-disclosure because they asked me questions about myself and they appeared to brighten when I shared about myself. However, it's unclear what direct effect this has on feelings of anxiety and safety. So while maybe they like sessions like that more, it's and that can also, I mean, that can affect anxiety, but it doesn't necessarily mean that me sharing directly affected their anxiety. It's just unclear from this data if that's the case, in my opinion. So yes, many limitations on this. Super small sample size because it was only a 3-month project, and I'm one person. It was not a double blind experiment, so I knew what I was measuring and I was measuring it. The kids didn't know, but ideally, if we had unlimited resources, somebody would be measuring it who didn't know what the experiment was about. Somehow we'd find a way to measure that. Also, like I said, I think the visual analog scale might have been less effective. I think if I could do it again, I would do faces or numbers. And then also, not every child that I saw was struggling with anxiety. So a lot of them didn't have surgeries coming up. They didn't have scary things going on. They were more struggling with pain management or nausea management or depression or just other things. So I think it'd be interesting in the future if I could do it again and I had, of course, unlimited money and all of that. Only children maybe that have been flagged for anxiety. And then the last thing is I wasn't specific about what I self-disclosed in the sessions. So sometimes I would talk about my cat. Sometimes, like a lot of times it would be a kid would say, I like this band, and I would say, oh, I like them too. So it would just be kind of like things worked into the conversation. I think it'd be interesting to talk about maybe just my surgery, and like study just that effect. Like, I don't know, or something, like if it could be more specific, because it was different for each kid what I shared. So what questions do we have about this? Any thoughts, reactions? All right. Oh, awesome data and interesting findings. Let's see. What question in the chat? Oh, somebody says, okay. What effect does the self-reporting aspect might have influenced the data? Also, even if it wasn't significant, did self-disclosure show improvement? Was the trend expected? So, yes, this is interesting. Yes, like I said, it's not a double-blind experiment. Ideally, it would have been somebody else measuring it. I do think, just frankly, I think that I wanted self-disclosure to be more effective. I think that that was maybe what I was looking for. So there is that. I think that that did have some effect. I think that's why I went for the scale, though, is because I kind of knew that I wanted it to be as subjective as or objective as possible. So that I was, and that's kind of why I studied it in the first place, was to see like, okay, am I just indulging in talking about myself with these kids, or is this actually an effective therapeutic intervention? And then for their second question, I hope that answered your question. If it wasn't significant, did self-disclosure show improvement? So it did show improvement. It wasn't significant, but both areas showed improvement by a good amount. I'm curious how the self-disclosure or not affected you as the music therapist. Ooh, that's a good question. What did you notice in yourself? Ooh, that's a good one. I think I preferred, so to be clear, in the sessions with self-disclosure, it wasn't as though I was spending the whole time with the kid just like, by the way, here's stuff about me. It was like relevant and worked into the conversation. And of course, we were focusing on whatever the kid was working on. But I think that I bonded with the kids more when I was able to share like, yeah, I like K-pop Demon Hunters too, and whatever they wanted to talk about. And it was kind of tough, like that situation where the kid was asking me questions about myself, and I knew that he was in the heads group, so I was like having to be like a blank slate kind of. I don't think that that's really the kind of music therapist that I want to be personally. I think that I just kind of gravitate more towards a friendship relationship with the kid, if that makes sense. Because I think a lot of in adult therapy, the blank slate is really beneficial, but for kids, like they seemed to respond more to like kind of a camp counselor aesthetic. Okay, I'm gonna answer one more for now before we move on. Let's see. Catherine says a larger sample size or focus on specific area, i.e. surgical intervention, you may have a significant difference. Could also focus on older age group because they are more amenable to that kind of disclosure to support them. Totally agree, Catherine. Would you consider using patient-reported outcomes surveys to assess pre and post results? That is interesting. I would. I think that would be really cool. Initially I thought of maybe just going in and doing a study of just my previous notes that already existed. I decided not to do that because I wasn't intentional about whether I had self-disclosure or not in the notes, and I think that would have. I really wanted the like most unbiased data as possible, but I do think it would be really interesting to go into like Epic and see all my notes that have like, oh, I shared about this and patient appeared to do this. I think that would be interesting. I'm gonna go on just to be mindful of our time, and then probably at the end I'll address some of these other questions. But thanks for being so curious. I really appreciate it. Okay. So this next project is completely different. You can forget everything that we just talked about. This is the Brenner album. So the Brenner album is a playlist of children's books, songs, and original songs by and for the Brenner community. It includes recordings from doctors, nurses, therapists, families, maintenance workers, and friends. Recordings involve a short introduction detailing who is speaking, their job, a fun fact about them, and what book or song they're sharing. So the idea of this is that for kids maybe with longer stays, this is something that they can listen to so they can get to know all of the people that they might meet in the hospital. And Lainey, if you would be able to share the video. I don't know, do I need to stop sharing? Oh, stop. But I'll just say the video is just a short compilation of people's introductions. So it has like their name, what they do, and like a fun fact about them that I thought would be kind of fun to share.
Okay. Can you see that, Sally?
Let me see. Yes, I can.
Okay. Susie shaking her head. And then let me know if you hear the audio.
Hi, my name is Supreet. I'm a lactation consultant, which means I help moms feed their babies. And a fun fact about me is I have a black belt in Taekwondo.
Hola, me llamo Aleya Monsalve, soy voluntaria en Brenners y vengo a tocar música con los niños en Sophie's Place.
Hey there, my name is Luke Neff. I'm one of the doctors. I'm one of the surgery doctors, and I take care of kids.
Hello, I am Grandfather, and this is
Grandma P.
Hi, my name is Miss Carolyn, and I'm one of the pediatric trauma nurses.
Hi, I'm Chaplain LJ. I'm a chaplain here at the hospital, which means I help kids and their parents feel emotionally supported.
Hello, I'm Grandma, and I'm down here taking care of my grandbaby today while her mother goes home and rests, and she just gets a little bit of energy to come back again. And I love kitty cats, and what I'd like to read a book to you today.
Hi, how are you? This is Eric. I work at the hospital sometimes fixing speakers and installing TVs. I might put up a projector here and there. You might see me on a ladder in the ceiling one day if you're walking down the hall.
Think of light, think of bright, think of stairs in the night. Ooh, stairs at nighttime are dangerous unless you have a light. You don't want to fall. Lots of things to think about. I hope you're feeling better, and I hope to see you in the hospital.
You hope. I just thought I had to share that little clip of Dr. Neff saying that he hoped to see us in the hospital. Okay. So the let me get the therapeutic benefit of this project is that it provides healthy environmental, developmental, and social stimulation. So like I said, there are a lot of kids with longer stays here, and this is something that they can listen to that's maybe more productive, and it's not super overstimulating. It is, I mean, there's like one picture to look at that is colorful, but it's not like a lot of things going on. It's also education about the hospital resources and staff in a child-friendly way. So kids can't read a lot of the time. And we have like super informative packets that we hand out to families that are often really helpful for the parents, but for kids, like they're not going to read a paragraph about what a speech language pathologist does. So the idea was that hopefully they could kind of get to know all the people in the hospital as people, and to hear them read a book and kind of spend time with them. And hopefully, again, this helps reduce their anxiety and fear. Getting to know all these people besides the person that gave me a shot and knowing them as the person who read me The Three Little Pigs can be really helpful. And then it also provided a really creative outlet for staff and families. It was really great to see how many people volunteered. I got like around 35 volunteers, I think. People were really willing to share their voices, and I could just see, especially for a lot of parents and families, they can see all these other kids in the hospital. They don't know what their diagnosis is. They don't know what's going on with them. They want to give them love, but they can't because HIPAA, like they can't just go into their rooms. And so I think that one of the beautiful things about this project is it kind of bridged the gap between the kids who were not getting a lot of visitors and attention for whatever reason, and the families that had extra love to give. So how it worked, I got consent from everybody that did it. So people that worked here signed a Microsoft form, and then families had to sign our like hospital's official media release form. And then we got the recordings either in Sophie's place in the recording studio, or in patient rooms. I brought the microphone up to patient rooms a couple times. And I even we normally go to trauma rounds on Wednesdays, and there were a couple times where I just brought the microphone and a couple of books, and maybe particularly busy doctors, I would kind of grab them and be like, hey, do you want to record right now? Do you have 5 minutes? And that's just how I would have to get them. And then some people recorded just on their phones and sent them in, and that was great too. So then I edited the audio and the video. As much as I could, I let people choose a little cartoon person to represent themselves, if people wanted to. And then I posted the videos on YouTube, and I advertised with flyers that looked like this, and flyers that looked like this. Okay. So what I found was that I think honestly one of the main benefits was the family support and the staff support. I think that kids are listening to it. The views are okay, but I think that truly the main benefit was the act of recording it and the feeling of giving without spending any money. And there were just, yeah, there were some meaningful sessions where I just, people seemed really happy to give, and they gave several recordings, and they talked about, like, you know, how much it meant to them to be able to give. One of the main snags is that YouTube Kids is an algorithm. It's not a person. So all of the patient rooms have iPads, but they only have YouTube Kids, which is a different app than YouTube itself. You can't post videos directly onto YouTube Kids. You just have to hope that the algorithm decides your videos are child-friendly enough to go on there. So I think maybe more views would help the algorithm. I don't really know. But there's literally no person to email or call or anything. You just have to hope that the algorithm puts it on YouTube Kids, which is really frustrating. So right now, people have to listen to it on their own devices rather than the hospital devices. But we're looking at ways to get around that, maybe trying to put it in like the patient portal app that they use. Another thing that I found was that everybody wanted to do books. A lot of people were scared to sing or do music. So I think in the future, I mean, books are fine and great, but I think like to get anybody to sing, I might need to be a little bit more intentional about like grabbing people that are particularly musical in the hospital and saying like, hey, you have to, or yeah. Also, the timing was a little bit of a struggle because again, I started this in the second half and I'm done after this week, so it's just a shame. Like there's a lot more recordings that probably could have been done. I would have liked to write more original songs about different professions in the hospital, but timing. I also found that presenting it to different populations was really interesting. So like I said, some people I just kind of had to catch them in the hall between meetings. And then some people we got to like really sit down and process the sessions. And then thankfully it is going to continue. So Lainey and the next music therapy interns will have access to it, and they'll be able to post things, and we have some people that are wanting to volunteer in the future, so it exists, and hopefully it will grow from here. Okay, what questions do we have about this project, if any, or just reflections, thoughts before we maybe wrap up?
Okay.
I think Deb has something.
Okay.
Hey, Sal. I was just wanting to, I think I did one of the readings and I was really surprised at how good it felt to do that. And I'm just curious about your thoughts on maybe looking more at some of the staff satisfaction or stress level changes that come from contributing something like this.
Yeah, I think that would be really great. Yes, your recording was great. I do think that kind of, I didn't see that coming really, that it would be so beneficial to people doing the recordings. I think like, especially that day at the TDP, getting you guys, like it seemed to kind of bring the morale up, and especially like the AV workers that were there. I don't know that I would have talked to them otherwise, and they turned out to be really cool. One of them played guitar, and yeah, I think it did have a pretty good effect. And I think a lot of times staff and adults in general, they don't want to do therapy, they don't want to do things for themselves, they want to do things for the kids. And I think this project ended up being a kind of sneaky way to do things for the kids, but also for yourself.
Yeah.
Sorry, I'm not like looking away, I'm looking at the chat. Okay. Well, lastly, I just want to say a giant thank you to mostly Lainey. I really appreciate everybody that's been here. This internship has been incredibly fulfilling and enlightening and amazing, and it's also been the hardest thing I've ever done. By the way, if you're reading these names and some of them look weird, they're code names for children. And anyway, all of you here, I've relied on you in different ways to get me through this, and I've needed all of your support. Lainey, you've been here every single day, and I really appreciate you. I appreciate your patience and how much care you have put into my learning here. And thank you for she's texting me. Thank you for fighting the parking people and the IT people for me. I've had supervisors before that frankly don't care if I live or die. They had me like on my knees doing chores for them, and Lainey, you don't even let me push your cart for you, and I've always felt like appreciated here, and I'm so grateful. So now that's it. Oh, but also here's my sources. Okay.